Question 1. Which of the following is a rare and progressive neurological disorder that primarily affects the cerebellum, leading to difficulties in coordination, balance, and speech? A. Huntington's disease. B. Guillain-Barré syndrome. C. Friedreich's ataxia. D. Creutzfeldt-Jakob disease. Correct answer is C. Friedreich's ataxia. Question 2. Which neurological phenomenon, often associated with migraines, involves visual disturbances such as zigzag lines, flashing lights, or blind spots, and is sometimes referred to as auras? A. Hemianopia. B. Photopsia. C. Diplopia. D. Scotoma. Correct answer is B. Photopsia. Question 3. What is the primary neurotransmitter associated with the neuromuscular junction, playing a crucial role in transmitting signals from motor neurons to muscle fibers? A. Serotonin. B. Acetylcholine. C. Dopamine. D. GABA, gamma-aminobutyric acid. B. Acetylcholine. Question 4. Which rare neurological condition, often referred to as the walking corpse syndrome, causes individuals to believe they are deceased, missing body parts, or no longer exist, despite evidence to the contrary? A. Cotard syndrome. B. Capgras delusion. C. Alien hand syndrome. D. Prosopagnosia. Correct answer is A. Cotard syndrome. Question 5. Which of the following neurological disorders is characterized by the sudden and temporary loss of muscle strength or control, often triggered by strong emotions such as laughter or anger? A. Narcolepsy. B. Cataplexy. C. Tourette syndrome. D. Conversion disorder. Correct answer is B. Cataplexy. Question 6. In neurology, what term is used to describe a condition where individuals experience the sensation of phantom limbs, even after the amputation or loss of a limb? A. Hemineglect. B. Neuropathy. C. Somatoparaphrenia. D. Phantom limb syndrome. Correct answer is D. Phantom limb syndrome. Question 7. Which rare neurological disorder, often associated with autoimmune reactions triggered by viral infections, causes sudden and severe muscle weakness or paralysis, typically beginning in the limbs? A. Bell's palsy. B. Transverse myelitis. C. Charcot-Marie-Tooth disease. D. Myasthenia gravis. Correct answer is B. Transverse myelitis. Question 8. What is the term for the neurological condition characterized by a sudden, temporary loss of memory, often associated with a traumatic event or extreme stress, where the person cannot remember their own identity or personal history? A. Anterograde amnesia. B. Retrograde amnesia. C. Fugue state. D. Dissociative identity disorder. Correct answer is C. Fugue state. Question 9. Which neurological disorder primarily affects the basal ganglia and is characterized by rapid, involuntary, and irregular movements, often described as dance-like or writhing motions? A. Huntington's disease. B. Tourette syndrome. C. Wilson's disease. D. essential tremor. Correct answer is A. Huntington's disease. Question 10. Which neurological condition, also known as locked-in syndrome, is characterized by complete paralysis of all voluntary muscles except for the muscles controlling eye movement and blinking, rendering the individual unable to move or speak? A. Guillain-Barré syndrome. B. Amyotrophic lateral sclerosis, ALS. C. Catalepsy. D. Persistent vegetative state. Correct answer is D. Persistent vegetative state. Question 11. In neurology, what is the term for a rare and severe form of epilepsy characterized by sudden, uncontrolled bursts of laughter or crying, often inappropriate to the situation? A. Myoclonic epilepsy. B. Gelastic epilepsy. C. Akinetic epilepsy. D. Atypical absence epilepsy. Correct answer is B. Gelastic epilepsy. Question 12. Which neurological phenomenon, often associated with brain injuries or lesions, results in the inability to recognize familiar faces, including friends and family, despite intact vision and general cognitive functioning? A. Akinetopsia. B. Prosopagnosia. C. Anton's syndrome. D. Alien hand syndrome. Correct answer is B. Prosopagnosia. Question 13. What is the term for a neurological disorder characterized by the uncontrollable urge to move one's legs, usually accompanied by uncomfortable sensations in the legs that are temporarily relieved by movement? A. Akathisia. B. Restless leg syndrome. C. Paroxysmal dyskinesia. D. Dystonia. Correct answer is B. Restless leg syndrome. Question 14. Which neurological phenomenon, often associated with certain types of epilepsy, causes individuals to experience a sudden and intense sense of déjà vu, as if they have lived through a moment before? A. Jamais vu. B. Capgras delusion. C. Presque vu. D. Déjà vu. Correct answer is C. Presque vu. Question 15. What is the term for a neurological condition characterized by the inability to recognize objects, shapes, or faces despite having normal vision, often caused by damage to the occipital or parietal lobes of the brain? A. Agnosia. B. Apraxia. C. Anhedonia. D. Ataxia. Correct answer is A. Agnosia. Question 16. Which neurological disorder, often linked to genetic mutations, results in the progressive degeneration of nerve cells in the spinal cord and brain, leading to muscle weakness, loss of coordination, and difficulty in speaking, swallowing, and breathing? A. Wilson's disease. B. Lou Gehrig's disease, ALS. C. Rett syndrome. D. Spinocerebellar ataxia. Correct answer is B. Lou Gehrig's disease, ALS. Question 17. What is the term for a rare neurological disorder characterized by the sudden and uncontrollable repetition of one's own words or phrases, often seen in individuals with certain brain injuries or disorders? A. Echolalia. B. Palilalia. C. Dysphagia. D. Anosognosia. Correct answer is Question 18. What is the name of the neurological condition characterized by a sudden and temporary loss of consciousness, typically lasting for a few seconds to a minute, often accompanied by muscle stiffness or jerking, and caused by abnormal electrical activity in the brain? A. Syncope. B. Narcolepsy. C. Absence seizure. D. Myoclonic jerk. Correct answer is C. Absence seizure. Question 19. What is the term for a rare neurological disorder characterized by the irresistible urge to move one's legs, typically accompanied by unusual sensations such as creeping or tingling, which worsen at rest and are relieved by movement? A. Akinesia. B. Ataxia. C. Paroxysmal dyskinesia. D. Akathisia. Correct answer is D. Akathisia. Question 20. Which rare neurological disorder, often referred to as jumping Frenchman of Maine, is characterized by exaggerated startle responses, including extreme reactions to sudden, unexpected noises or movements? A. Myoclonus. B. Hyperkinesia. C. Hyperexplexia. D. Tic disorder. Correct answer is C. Hyperexplexia.